Okay, I'm Keith Allison. I'm a consultant plastic surgeon in the northeast of England in a place called Middlesbrough, and the area that drains is really North Yorkshire, areas south of Newcastle, and then to the west as far as the Yorkshire Dales. I've been a consultant approximately 6 years. 5.5 years of that time in Middlesbrough, and I have a full-time NHS practice there, predominantly concentrating on cancer and cancer reconstruction and trauma reconstruction, so things like skin cancer, breast cancer and breast cancer reconstruction, and then people from road traffic accidents with limb injuries that we fix. And then I have a busy aesthetic or cosmetic surgery practice also based locally in Teesside at our local Nuffield Hospital, and really there I get the opportunity to operate on patients who want facial changing surgery, breast changing surgery, surgery which is not funded within the NHS, or surgery which they would like a little bit more control of in terms of who they're going to see, when they're going to be able to have their surgery. So that's the basis of my practice, and within the cosmetic side of things I look after patients for facial rejuvenation, for breast enlargements, breast uplifts, breast reductions, abdominal surgeries and contouring, and eyelid surgery, for example. So a fairly broad range of surgeries. In terms of why did I get into plastic surgery, it just happened from school that I'd had a period of parental unemployment for a while, and I wanted to have a job which I felt that I would be employed with and that would be interesting and was not a desk-based job. And then through medical school I actually spent some time in the United States and worked and lived with a plastic surgeon in Minneapolis and then in Winnipeg in Canada, and that kind of fired the resolve to do a plastic surgery specialty rather than any of the other surgical specialties which I was interested in. So I completed my training in Sheffield and then went back through Sheffield, down through Staffordshire and back to the West Midlands, and completed a surgical training scheme in the West Midlands and went to Canada for some time there to do some microsurgery or reconstructive time, and also down in and around East Grinstead and London as well. So I've been relatively well travelled during my time. The idea of private practice from my point of view, or the aesthetic practice, is to have the time that I need to see the patients. So I'm not driven by getting a certain person through in a fixed and small amount of time. So I'll see a patient for the first time, get to meet them, ask them questions about themselves. They get to meet me and try and sort of maybe suss me out a little bit, and then find out what the patient would like to talk about and what they don't like about themselves or what they would like changing about themselves. And for most patients that's absolutely straightforward. They have an idea that they don't like an area of their nose, or they don't like their jowls, or they don't like their tummy now they've had 3 children and it's beginning to sag, and in which case we focus in on that area. If someone comes in and they're less focused about a particular body area and they come and say, well, what can you do for me? I feel a bit more uncomfortable about that. So it's more a case of having an idea of what you would like before you come in through the door, and then after that we talk about the options available to the patient, what I feel in my hands might be a good choice for them, and then we maybe go through some photographs of patients that I've looked after, so give them an idea of positioning of scars, results, to try and put some reality in terms of results and their expectations of those results, and then I give them some information leaflets that I've specifically written or that associations write, and they go away and have a think about things, and then they can contact my manager to come back and see me for a second time and spend a bit more time, go through questions they have, still have or have not cleared in their mind, or something new that's popped up. I encourage them to bring someone with them to support them, or an interested party, partly because it makes them feel a bit more comfy, partly because you never know who's actually going to come in with them anyway. And then after we've established what we're going to do, We then decide when, the cost of that, and I talk about time off work, recovery time, the potential pitfalls and complications of this kind of procedure that they're going to undertake, and look at things in reality. So how long is it till I can drive, having had a breast operation? How long is it till I can go back to the gym? Or how long can shall I book off of work? What happens about sick notes? All those kind of things we cover, and then I talk about my follow-up regime. And my regime for most patients is to see them myself with our nurses in about a week after their operation, and then sometimes 2 weeks. And then I have a gap till about 6 weeks post-operatively, and then between 3 and 6 months for most of my patients, I see them then. And by that stage, most things are settling down, and I'm discharging them until they come back for something else. Oh, typical day starts at between 6 and 6:30 in the morning, and I usually need to get up to either finish some paperwork or to go to the private hospital to see patients that I have there. And that allows me to go and see people, make sure they're okay, and then I go to my NHS place and start there between 7:30 and 8, and normally have a full day in the NHS on at least 3 days a week. And then at the end of that NHS day, then I may be consulting in the private sector in the evening or operating, and then I generally get home about 8 to 9 o'clock in the evening. One day a week, which for me is a Tuesday, I do a full day of consulting and operating in the private sector. I base my practice really around my full-time NHS practice, so I do an on-call week in the NHS. So 1 week in 5 or 1 week in 6, I don't do any private practice at all. It's just so I'm on call for the NHS. And the rest of the time, I'm at the private hospital and the NHS hospital most days. I think the variation. I like making things look nice. I think plastic surgery is it's not just about opening a textbook and saying I'll do that. There are lots of different shapes and varieties of people, both in size, shape, colour, and general makeup, and so there isn't a one sort of fix for everybody. So the variety is excellent. We look after different body areas as plastic surgeons. That's also excellent. And generally we're looking after patients, particularly in the aesthetic surgery side of things, who are well. There's a range of age groups of patients, and so patients come back to see you afterwards and sort of tell you how they're feeling about things, and it's great.